Welcome to the Foundation Frontiers educational series on Comprehensive Genomic Profiling, or CGP. In this video, we'll discuss using CGP for select hematologic malignancies. These videos are for educational purposes only. This image shows some broad categories of common hematologic malignancies. In this video, we'll discuss applications of CGP in two hypothetical patient cases of acute myeloid leukemia, or AML, and B-cell acute lymphoblastic leukemia, or BALL. For many hematologic malignancies, accurate diagnosis can require extensive clinical workup with integration of clinical history with a variety of ancillary testing. Immunohistochemical stains, or IHC, and flow cytometry allow for examination of protein expressions on cells. Cytogenetic analysis examines changes at the chromosomal level, while molecular testing can examine genomic alterations, such as copy number changes or gene mutations. Let's discuss what type of samples can be submitted for CGP testing with Foundation 1 Heme. There are two types of sample kits that can be used for testing with Foundation 1 Heme. Peripheral whole blood or bone marrow aspirate samples can be submitted using a HemeFresh kit. DNA and RNA is extracted from the blood fecal and sample, meaning from the blood cells. Formalin-fixed paraffin-embedded samples, or FFPE, may be submitted with the Heme tissue kit. In this next segment, we'll discuss a patient case. An 18-year-old male patient with a history of asthma presented with severe headache and loss of peripheral vision. Routine labs were done. A differential count of the blood by the automated instrument showed that the white blood cell count was increased, and most of the white blood cells were eosinophils. Increased eosinophils can be seen with asthma. However, this patient also had thrombocytopenia, a low platelet count, which is not expected in asthma patients. Molecular testing can be ordered based on a clinical suspicion of blood cancer without a confirmed diagnosis. Based on the acceptable samples for Foundation 1 Heme CGP testing, would it be appropriate to send a blood or bone marrow sample for CGP testing without a confirmed hematologic malignancy diagnosis? The answer is yes. Foundation 1 Heme can help establish the patient's diagnosis. Here's a summary of the findings from a Foundation 1 Heme CGP report. A characteristic IgH-IL-3 translocation was detected, allowing for a diagnosis of BALL for this patient based on the WHO or World Health Organization classification system. To summarize how this patient's clinical presentation and genomic findings can correlate with the BALL diagnosis. Our patient was an 18-year-old male with elevated white blood cell count, eosinophilia, and thrombocytopenia. The detection of the IgH-IL-3 translocation allows a diagnosis of BAL that fits the clinical presentation. This subtype of BAL mostly affects children and young adults and can be difficult to diagnose due to the propensity to present with low blast count. It is characteristically associated with a fluoride background of eosinophils that can raise many other diagnostic possibilities. The IgH-IL-3 translocation detected here allows for definitive diagnosis. The chromosomal translocation detected in this patient involves the IL-3 promoter on chromosome R5q and the IgH enhancer on chromosome R14q, which can lead to overproduction of IL-3 and increased eosinophils. While this translocation may be detected by other methods, the precise translocation partners can be difficult to characterize accurately using these other methods. What are the advantages of using Foundation 1 Heme for patients with suspected acute leukemias such as BALL? Both answers here are correct. CGP testing with Foundation 1 Heme could detect different types of genomic alterations. to inform diagnosis in a single assay and can be performed with several different sample types. In this second patient case, a 72-year-old male with a history of diabetes and hypertension presents with blood test results showing elevated blast count, indicating suspected acute myeloid leukemia, or AML. The AML diagnosis was confirmed via flow cytometry immunophenotyping. Nevertheless, AML is still a broad diagnosis, and AML can be further divided into subtypes based on the genomic alterations harbored by the leukemic cells. These alterations may be detected by molecular profiling, which can refine the diagnosis, assist with targeted therapy selection, or clinical trial enrollment. With a known AML diagnosis, what additional information could CGP testing with Foundation 1 heme provide? Both answers are correct here. CGP testing with Foundation 1 heme could detect genomic alterations important for subtype classification as well as eligibility for targeted therapies. In this case, the key findings from the Foundation 1 heme report included a FLT3 internal tandem duplication, or FLT3 ITD, as well as an NPM1 hotspot mutation. The FLT3 ITD in this case is long, which is a duplication of a total of 66 base pairs, leading to the addition of 22 amino acids. Foundation 1 heme can detect different alterations in FLT3, including relatively long FLT3 ITDs. In AML, FLT3 alterations result in downstream oncogenic cell signaling and are associated with poor clinical outcomes. The image on the bottom of the slide shows targeted therapies with clinical relevance associated with AML harboring FLT3 alterations. Investigational therapies are also available targeting FLT3 alterations. Professional guidelines recommend evaluation of FLT3 alterations using either NGS-based assays or multiplex gene panels. Besides NGS-based assays, FLT3 alterations can also be detected by other methods, such as PCR with primer sets amplifying a specific portion of the FLT3 gene, followed by capillary electrophoresis. Nevertheless, CGP allows for detection of many alterations in a single assay, not just FLT3. Furthermore, Foundation 1 heme provides information on variant allele frequencies that can be informative for risk stratification of AML. Based on the previous slide, can Foundation 1 heme provide quantitation of genomic variants like FLT3 or NPM1 alterations? The answer is yes. Variant allele frequencies listed in the genomic findings section of Foundation 1 heme reports provide this information. Thank you for tuning in to this video.